I'm a certified diabetes educator. I've been a registered nurse for over 30 years, and I'm the associate nurse editor for Present Diabetes. We are here today in St. Louis, Missouri at the annual meeting for the American Association for Diabetes Educators. Here with us is Hope Warshaw, registered dietitian, certified diabetes educator, and the nutrition editor for Present Diabetes. Hi, Hope.
Hi, Joy. Great to be here.
We're so glad you could be here. I'm glad to be here. Hope, so many of us that are healthcare practitioners that are not dietitians work with people who have diabetes. And everybody asks us, what can I eat? What can you tell us to tell our patients?
Well, I think the first thing that practitioners need to say is, and what I say to people is, anything that you're hearing from good sources like the American Diabetes Association, Heart Association, the federal government about healthy eating guidelines are healthy for people with diabetes. In other words, a good example, and one that I start with because it's something you can say eat more of, is eat more fruits and vegetables. Same information for people with diabetes. So that sort of takes away the concept that this is a special diet.
It's not a special diet?
Right. This is about healthy eating. And I think then you have to get really concrete with people. And you need to start with people from their orientation. Now start with, what are you eating now? And one of the easiest places to help people make changes in is what they're drinking.
Really?
People can be drinking huge amounts of calories, and they don't even realize it, and it's something that people are pretty willing to change. You think about it. You see people with these big coffee drinks either in the morning or the afternoon. I mean, some of them, the whipped up things, I'm not going to name any names, can have 300 and 400 calories. A 20-ounce container of soda, 250 calories. A sweetened iced tea. I mean, by the end of the day, it is no sweat for someone to be drinking 700, 800 calories. And you and I know, if you can even cut that in half,
wow,
you know, you'll start seeing weight just shedding off of you. So I think that that's just one example of a good place to start. But being very concrete with people, even writing some just 2 or 3 nutrition and food goals in their chart. And then next time they come back, touching base with those to see if they've made any headway, and if they have, great. And every pat on the back with someone related to any behavior change, but particularly food. You know, we're having in our society today to talk to people about being fish swimming up, trying to swim upstream in our environment. I mean, we just got out of hearing former Governor Huckabee, who has changed his life dramatically around food and activity. And I talk about it changing the environment. He talked about the atmosphere. We're saying the same things.
Yes.
But in the meantime, we're stuck as people who are trying to eat healthy as fish swimming upstream. And that's very hard to do.
Would you suggest that people who have diabetes see a registered dietitian?
No, of course. I mean, unfortunately, the statistics, and this is for general people seeing diabetes educators, is about only 30% of people ever even once see a diabetes educator. And people absolutely need to seek out diabetes educators. If it's a diabetes educator who has a food expertise as a dietitian, you know, that's great, but I think hopefully your any-day average diabetes educator can gear someone in the right direction around food.
How does one go about finding one?
Well, I think the easiest way and probably best way to get to a diabetes education program is to go to the American Diabetes Association's website, diabetes.org, look for, I mean, you can search under education recognition programs or recognized education programs, and you will get to a state-by-state listing of the programs that are in their state. I think that there are roughly 3,000 programs
Wow.
around the country. It's not huge, it's not nearly what we need, but then you know you're getting to a program that typically has an RN and a registered dietitian on staff. And you know, these are programs that are reimbursed by Medicare.
Okay.
And more insurance companies and private insurance companies are covering diabetes education. And so you know you're getting to a program that's been accredited, and you know there are more than likely dietitians who are CDEs, certified diabetes educators, at those programs.
Okay, that's great. Now, one personal question for you. Why did you choose to become the nutrition editor for Present Diabetes?
Well, you know, you actually got me involved in doing the carbohydrate counting beyond from basics to advanced.
And what a lecture. Wow, I just love it, and I think every healthcare professional should listen to that.
Well, and that really led me through that process of seeing what Present is all about, and to see that they are very firm in developing quality programs, and you know me well enough to know that I always want to be associated with quality. And I feel that particularly allied health professionals, their budgets are being cut for going to education programs, and we at the same time have the advantage of incredible access to technology, which is what Present Diabetes is utilizing to allow educators and all health professionals to, you know, do these kind of lectures, go to these lectures, sort of go to, but 24/7 you can have your bathrobe and your slippers on, do it when at the convenience of your time. So I really just liked the plan of Present Diabetes and wanted to be associated with it.
I'm so glad that you are.
Thanks.
Yes. Oh. So we thank you for being here, and to learn more about this conference or any of the lectures at Present Diabetes, go to presentdiabetes.com. This is Joy Pape, and I want you to enjoy life.